Very good morning. Today we are going to discuss about the collection and the preservation of throat swab. So, how to swab your throat in the right way for a COVID-19 at home test kits? Okay, so the throat swab is very familiar and famous during the stage of COVID. But before COVID also, the swab is practiced in medical field whenever they have the chronic throat infection and tonsillitis in some other medical conditions. Okay, stick out your tongue. The tongue should be stick out, the first thing. Okay, because the swab should be taken the deep or the back portion of the tongue. So find your tonsil or oval shaped pad of the back of your throat below the awkward roof of your mouth. So in this condition, we should avoid touching the tongue, teeth, or insides of your cheek with the swab. The swab should not touch tongue, should not touch teeth, should not touch insides or your cheek or any other parts apart from the tonsillitis. Okay, the oval shape tonsil pad. Okay. சுமன மீட்டிங் சொல்லுங்க பண்ணு ஃபுல்லாக பில் பண்ணிட்டியா டோர் லாக் பண்ணிடு மீட்டிங் முடிச்சுக்கோ போகிறேன் பத்திரம் லாக் பண்ணிட்டு போயிடு Okay, so the sweep the swab across both tonsil for several seconds. Okay, this is not necessary just the swab should be a gentle one side we can touch or streak. It should be uh, a few seconds good across both the tonsil like this. Be gentle but swab judicially back and forth at least 4 times. Back and forth. முன்னும் பின்னும் என்ன பண்ணும் ஒரு 4 times நம்ம அதை யூஸ் பண்ணணும். Okay, so this is the anterior and posterior pharyngeal pillars. So this is the soft palate and this is the anterior tonsil pillars and this is the posterior tonsil pillars and this is tonsil foresock and valvula. So this is the area which we are going to take a swab. So you can see very clearly this is the nostril swab, the nostril pharyngeal swab. So it should be reach here through the nose. Otherwise, you'll get the error result. Okay. So method of collections: the throat swab and the nostril swab, a nostril pharyngeal swab, and throat swab. So easiest sample to be collected by having the patient open his or her mouth wide open, and the patient should try to resist gagging and closing the mouth during sample collection. The posterior pharyngeal wall and the tonsil should be swabbed. So by this other method, we can use the swab. We can see 3 times, and the nostril swab, the inside swab into the nostril along the lower floor of the nose till the one reach below the anterior turbinate. Below the anterior turbinate. And leave the swab in place for a few seconds for absorbing the fluid or the infection or inflammation deposited in the swab. Slowly remove the swab while slightly rotating it. It should rotate all the sides. It should be rotate all the sides of what? The swab, and put it swab into a vial containing VTM on breaking applicator stick. Okay, so the stick will be dip the vial containing the medium. Vial containing the medium. So both the nozzle and the throat swab can be collected into same VTM to increase the viral yield. Viral yield. Okay, so the nozzle pharyngeal swab, this can be collected by two methods, one through the nozzle route and through oral route. So in both the way, we can collect nozzle pharyngeal swab. So nozzle pharyngeal swab through nozzle route. So insert a thin flexible swab into nozzle, right up to the nozzle pharyngeal. Leave the swab into place for a few seconds. Slowly remove the swab while slightly rotating it, and use different swab for a nostril. So this is very, very important where we have to take the sample, how to mark where we reach the swab, because in if you not properly touch the pad where we touch the place nozzle or nozzle pharyngeal, will get only the fluid. The fluid does not contain the exact the infection causing agent, maybe the microorganism, bacteria or virus, whatever it may be. So the swab should reach the end root, and you have to rotate 2 to 3 times and back and forth 2 to 4 very slowly, and we have to remove without touching the walls in case of nozzle. In case of tongue, we should not touch the tongue and the teeth or inside the cheek. It should only touch the palate of the tonsillitis. Okay, and so once you collect the swab sample, then the labeling is very, very important, because the sample will identify by the preferred usage of pre-printed barcode. Barcode may contain the date and the patient ID code, whatever it may be, and the labels. In case of non-availability, the following label can be pasted on the specimen container. Okay, in case the barcode facility is not available, we have to label the details of the patient and the sample date. The label material should be made of leucoplast available in the hospital. Only ballpoint pen to be used for labeling. Do not use ink or gel pen, because the ink pen, gel pen will be dissolved or erased. Okay, so the ballpoint pen should be printed. We can write, it shows the letter for a long time. The sample should always be accompanied with the clinical proforma duly filled by the physician. Okay, and storage. So once the sample is collected and labeled in proper way, the date and the name of the patient, age of the patient, sex of the patient, and what are the tests going to be done, everything should be present in the label. And the after, if the sample, it may performed as soon as possible, it doesn't matter. Or if there is no facility on the same lab, it is supposed to be shift a courier or send a parcel too far. The storage is very, very important. The sample should be sent to the laboratory as soon as possible at 4 to 8 degree, but not later. So you can store 4 to 8 degree, and that not later than 48 hours. We should send within 2 days. In case of the delay beyond 48 hours, the specimen must be stored at -70. In case if we could not save, we send the sample at -70. Avoid repeated freezing, that thawing of sample. So freezing, thawing should be avoid, otherwise the sample will be destroyed. So the swab is very, very the important technique, which is highly helpful for the physician and people to recover, to identify the infections, the viral infections or bacterial infections. And many times in case of the tonsillitis also, if he or she may give the information. We can collect the sample, identify the condition of the wound all. So thank you. Thanks for watching. Thank you.